And good morning or afternoon at this point. It is October 8, 2024. I'm Dr. Deuk Plasma Rhizotomy. Our patient travels from Bradenton, Florida. He is actually has horrible neck pain. It is coming from his facet joints, the second most common cause of neck pain. And Jordan, can you show us, take a picture on the x-ray, take a shot, let's get rid of that thing. Look at the arthritis, folks. That big beak coming off to the left. See the beak right there? It looks like a parrot's beak. That is a huge arthritic bone spur. It's evidence of arthritis, and that's where his pain is coming from, the facet joints. That's what we're going to fix. And it's worse on the left. He doesn't appear to have much on the right, so we're going to focus our attention on the left side today. Incision. I'm making a 4mm incision. We're going to go through this tiny little incision, and I'm going to go down and basically do what's called a rhizotomy. Now, Henry, let's show our audience, how do facet joints cause so much pain?
Copy that.
All right, you've seen how the facet joint can be so painful. The answer is inflammation. Same as the disc, except instead of being on the disc, it's on the facet. All right, let's get up here. And by the way, our last patient that we did the DLDR on is doing fantastic, almost ready to go home. Shot? Any questions from our audience?
At this moment, no current questions. So in the meantime, why don't we show the audience of how this procedure is performed?
I agree. Jordan, would you be able to derotate the fluoro? You can see the spinous processes are off up there.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk Plasma Rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk Plasma Rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. And you can see from our video how the facet joints can cause so much pain. The arthritis or inflammation is happening in the capsule around the joint. That capsule gets full of inflammation as the body tries to heal the capsule, and it's unsuccessful because every time it gets a little healing done, you turn your head and you re-injure the capsule. So the capsule never heals. It's like having a non-healing wound, which we all know non-healing wounds are very painful. It just keeps getting inflamed over and over again. Shot? All right. Any questions, Sean?
At this moment, no current questions.
I tell people this is probably the most painful surgery I do. And the reason it's so painful is the muscles in the neck, they get a little bit of blood in them and they end up causing pain. Shot that lasts. It can last actually for a few months in the worst case scenario. Shot. Any questions from our audience?
At this moment, no current questions.
Shot. All right, we're using the X-ray machine to navigate. Shot. Looks good. I need about 5 minutes, Dr. B, and we'll be done. He has some scoliosis, huh? And you can see the spine is twisting. How's he doing, Dr. B? All right. 5 minutes maximum. Everything's going well from my standpoint. We're hitting all of our targets. Henry, have we played both videos?
Correct, sir. Yes, we have.
All right, good. Well, let's show the audience, since there's no questions, what are
we
the...
just got a question, just as you said that.
Sure. Hey, Jordan, can you derotate, please?
This is coming from
I'll take the question.
Robert on YouTube asking, is pain from facet joints usually more from movement? How do you differentiate facet joint pain from radicular pain?
That's a good question. Thank you, Robert. Radicular pain is pain down the arm or leg from a pinched, but usually from an irritated nerve root. And it's irritated from inflammation happening in the facet or the disc, usually the disc. So radicular pain is pain down your arm. Facet pain is pain in your neck. It's the location of the pain that tells you the source. Radicular pain is never in the neck. Yeah. That's one of the biggest misunderstandings or misinformations. People think that a pinched nerve causes neck pain. It doesn't. Pinched nerves never, ever, ever cause neck pain or back pain. They cause arm pain or leg pain. But never do they cause neck pain or back pain. Almost done. Great question, by the way. Thank you for asking.
At this moment, no current questions.
And we show the 30 causes?
We have not. No.
Let's do that.
Of course.
I'm Dr. Deuk Plasma, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury, to the capsule will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk Plasma Rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. We are done. You can see the incision is just 4 millimeters. And yeah, I would do the, that's fine. A little bit of glue and then pressure bandage. But you have to let it dry. Okay, I'll take the question. We're done with the surgery. We've just done a rhizotomy of the C3-4, 4-5, 5-6 facet joints. They're full of arthritis. They're causing him horrible pain and stiffness on the left side. Whenever he turned his head to the left, he would get sharp pain. That is facet joint pain. And we've just performed the world's best surgery for facet joint pain. Unlike RFA, this surgery works and it's permanent. There's no need to come back and keep getting it done like you do with an RFA. I'll take the question.
Question coming from Robert once more on YouTube asking,
Move all this over.
can facet joint pain cause trapezius pain or rhomboid pain?
The question is, can cervical facet joint pain cause pain into the trapezius or rhomboids? The answer is yes, absolutely it can. Very common. That's called referred pain. It refers down into the shoulder through the trapezius. This stays with the chart. That stays with the chart. This can stay with the chart. Just these. Okay, great question. Any others?
And that is it for questions.
All right, very good. Well, thanks for joining us. We're all finished with the cervical Deuk Plasma Rhizotomy. We lost a few drops of blood, and that's all. And we'll be back with you all next week because we're closed Thursday for a hurricane. Hurricane Milton.